left ventricular assist device, also known as LVAD, is for advanced heart failure patients. The heart function is to provide blood flow to your end organ and the whole body, and also to provide oxygen. So when your heart is weak, so it's not providing that support to the body, that medication is not enough. And LVAD is an artificial pump in which required heart surgery. So a heart surgeon can insert that pump into the heart, and can be done minimally invasively in terms of surgery. And obviously, as you can imagine, there's benefit with minimally invasive surgery. With the advance in pump technology, the pump have gotten smaller, and also the efficiency has improved with the new generation of LVAD, and also is more reliable. We improve the blood flow and oxygenation of your end organ, your liver, your kidney, your brain, and so forth, but also improves patient recovery a lot faster. Patients have less symptoms, less breathing problems, more energy to do things.